good afternoon to all of you. Thanks for joining us in today's episode of Inspire India. I am Afrida Rahman Ali. Well, the human spirit of lending a helping hand is still very much alive. And to celebrate that spirit, we are going to bring you stories of hope and humanity from at least 2 cities from across India in every episode to talk about those who are stepping up to help and to provide relief and succor to those in need, to the vulnerable groups where the government and the authorities have failed to do so. So what we are going to do is we are going to bring you the tales of hope and humanity, like I said, to actually celebrate that human spirit which is working relentlessly, selflessly on a day-to-day basis to help out and reach out to the ones in need. So we are going to, in fact, introduce our do-gooders, the Good Samaritans that we are featuring today. Ashwini Kumaran from the Prakruthi Township Residents Association is joining us today. Ashwini, I want to first tell our viewers your story before I come to you with my questions. So here is a bunch of residents who have joined hands to pool in money and help those who are in need. So Bengaluru-based Prakruthi Township Residents Association has set up a COVID war room to help people in getting oxygen supplies, access to ICU beds, reaching out to the vaccination centers. Now with donations from the volunteers, the association has been providing the needy with oxygen cylinders, directing patients to oxygen suppliers, and also arranging plasma where necessary. Ashwini Kumaran is with us. Very good afternoon, very good evening. Thank you so much for joining us here on Mirror Now, Ashwini Kumaran. I want to, yes, begin by asking you that how did you think of starting this? Because somebody takes an initiative, somebody decides that, well, we can do this without any help from authorities or without any government assistance. You must have felt that somewhere to begin a community partnership of this nature. Tell us more about how you started.
Hi, good afternoon. My name is Ashwini Kumaran, and I'm very glad that from my association, I'm a part who's live on today to speak about the pandemic which is going on. So now in this pandemic, it was a tough time for us to decide and make a team and come together and work on this. So as such, when we came to know that there are many people who is in need of beds, oxygen, testing kit, and medicines, injections, vaccinations, so we in our association, the 13 members who are included, we decided to bring up a war room, set up a war room, and go ahead to help the patients and the people surrounding us.
Right. Which is why I want to ask you this question, ma'am, that when you do something of this nature, bring people together. Of course, nowadays we know that with social media and with WhatsApp groups, things have become slightly easier. But are you also telling us that when one person makes up the mind and decides to do something, others follow suit? It's just about showing that initiative and that enthusiasm to do it. How did others join you? How did you motivate others?
Actually, others, we tried calling them and we put across a lot of messages in the groups, in our residents, and we asked them to help us in the back end and the front end. But with a great heart, they came forward to help us. So immediately there were many people who were really happy to help us to help us in this situation.
Yes, and you are from Bengaluru, and I must say, Ashwini Kumaran, that this is a city which is going through a terrible crisis. The hospitals have no beds. There are so many deaths that has happened in Chamarajnagar in Karnataka. Even now we are tracking details of so many deaths that have happened because of oxygen short supply. So clearly the authorities have failed to do their job. We are taxpayers, we pay money to the government to do this job, which the authorities have failed. Now, somewhere, did that occur to you that, we are not going to depend on people, on authorities, on civic bodies or local administration. We are going to do this ourselves. Is that something that inspired you or occurred to you when you decided to take this upon yourself?
No, actually, the people, they were misguided with the website, the forwarded messages, and the WhatsApp. So people were, it was a difficult situation for them to get in touch with the exact hospital, the BBMP people, everyone. So at that point of time, we approached our BBMP, the North Zone, and we asked the help of them. So when they gave us a few datas, with that few datas, we started looking into many things. So like that, around the clock, it's not only our zone. We are now into the entire Bangalore city, that we have collected many people's numbers, and
Okay.
our volunteers, they are doing the validation. They are coming up with who is having the stock of oxygen, where is the bed availability. So we are able to give them, we are able to give the patients the particular area, we are able to give them, provide them all the numbers. So from BBMP side, we are very happy that they have helped us.
Okay, so that's interesting, and that is something new that you're telling me now, that this is in collaboration with BBMP. So you're filling the gaps, you are doing that last mile coverage where the BBMP fails to reach out. These kind of resident association is filling up for those gaps. And is this something that the others can emulate, Ashwini Kumaran? I want to know, because obviously there would be other resident associations also going through the same issues, and this is a consistent problem that there is a resource available somewhere, there is a person who is in need somewhere else, but just to connect the two. From what I understand, that is what you're essentially doing.
Yes, right. And it's a very challenging issue, challenging phase which we are facing now, because the other zones like East, West, and South, we are unable to connect with them, because the people, when we call them, it's only ringing, but we are not getting up any help from them. So as a citizen of Bengaluru, I would really request BBMP people also from all over are this thing. If the government, every government knows that each and every area has got an association like this, if they can help us with some updates every day with the clear data, we can join hands and we will be able to help them, the government, as well as the people of our India also.
And that's such a great idea, Ashwini Kumar. And what you're telling me today is that, you know, every township, every residential complex can become a resource pool in that sense. And if everyone steps up in this manner, the entire city is covered, because then you know how to connect, where to connect, when to connect. And it's just about putting it all together under a single network, and it should not be that difficult from what you're telling us. If the other residential societies also come up, do you think such a model is possible, this kind of a community partnership, taking responsibility within your residential society first and then reaching out to others and then making it like a model of sorts to help out everyone in that city? Is it possible to do this?
Yes, it is possible to do. Is it very much possible to do when the government as well as the people of India, of Bengaluru, they come forward, and with almost all the datas, every nook and corner, definitely we can help each and every people now.
That's so reassuring, Ashwini Kumaran. And the fact that in Bangalore you're doing this, we are featuring other people as well from Bengaluru, whether it is the relief riders, whether it is a restaurant which is helping out in distributing free food. But what you are doing is this very important networking of giving out information for the important and essential and necessary items which people need, be it oxygen, be it an ICU bed, or any other medical help. So I'm going to also introduce my second guest. Joining us today is from Helping Care Welfare Foundation. It is run by Lokesh Munjal and his wife, Vishibha Munjal. Vishibha Munjal is with us right now. Now, Helping Care Welfare Foundation has been supplying oxygen cylinders, concentrators, medicines, and N95 masks for those who have been scrambling for these essentials. At least 300 people, we are told, have benefited so far. Now, the team, Munjals, along with their team, have set up a mini 10-bed COVID center as well to help out those who need it in case of emergency. Visiba Munjal, very good evening and thanks for joining us. And I want to again begin by asking you that at a time like this in Delhi, where the crisis is severe, people are scrambling for beds, and we all know, because we get those messages on a daily basis, on how people are struggling to get even an isolation bed is not easy to get in Delhi. Forget about an oxygenated or an ICU bed. How did you start this? To what extent are you able to help? Okay, I am not able to hear Vishiba Munjal, I'm afraid. We'll have to try and reconnect with her. Yes, so basically we were just talking about this whole effort that an individual can make and reach out to others and form a network of people. This has happened in multiple locations where civil citizen groups have stepped up. And it is so necessary, rather than sitting back and hoping that some authority somewhere will come and do the needful. When citizens step up, this is something which is so inspiring. Ashwini Kumaran, I also want to ask you this question about how do you manage to invest your time and energy? How do you motivate yourself? Because this would be exhausting. It would take a lot of legwork, isn't it?
Yes, it is, but it's a personal interest of mine. I'm a house with two grown-up kids. So managing home as well as my this COVID war room, it is a difficult, it is a tough thing, but I manage it. It's giving me pleasure to help many people actually. So I'm happy. So it's not a stressful thing for me.
Yes. Absolutely, and hats off to you. Really, we salute good Samaritans like you who are doing this job selflessly on a daily basis. But tell us, from your understanding, since you are connected with so many people, how severe is the crisis in Bengaluru? What are the main areas of concern from your experience?
The main area of concerns from my side is the ambulance. We need ambulance. Oxygen is a main thing, and the people here, even to supply oxygen also, they are charging, which we need not have to do at this point of time. So how much ever people can help the others, it'll be a helpful for them. And the availability of beds, where we are not able to get a proper data. So if the government, definitely, if the other zone, BBMP zone war rooms, if they can help the associations with giving a lot of data, the ambulance numbers, the oxygens, availability of beds, and where are the testings can be done for home test, or whether to come up to the hospital and do. See, from our side, definitely we will be able to help many people at this point of time. So that is what I am looking out for. The government pressure will be, we can make it a little less, and we can also be a part of it. It will be so that both of us together, we can join hands and we can help many people actually.
Yes, I hope the authorities are listening, that there are citizens out there who are willing to do their bit, rather go extra mile, in fact, step out of their comfort zone and do their bit. And there can be a collaborative effort to fight this. Vishiba Munjal is finally connected to us. Vishiba Munjal, I was asking you that since the crisis is very severe in Delhi, for someone like you and your husband to set up a COVID center, to provide this kind of a facility with oxygen concentrators, which you are also able to supply. Tell us, how are you doing this? How many people are getting help from you at this point of time on a daily basis?
As a team, we are working in this organization. Like me and my husband are founder of this foundation, and we are helping in any sense we can. Like during this pandemic, we are feeding poor people also, and that the utmost problem going on is the lack of oxygen, for which people are dying. So we
Yes.
have provided oxygen cylinders also, including like and taking the help of police also, Delhi police, and they are really helping us to get the cylinders refilled in any sense, or to the means providing cylinders to the needy people in any sense. So we are directly going to the people also, and we are asking people to approach us for the cylinders also. In any sense, we can help them. And we have set up a COVID care center also, in which we have 10 beds as of now, where we can, if people who actually need oxygen, only oxygen is needed. So require
Are beds
no need to
available with
plan.
you, Vishiba? I'm asking
Yeah.
you because even as we speak, there are people looking for beds. And how do they reach out to you?
See, people reach out over call only, and they come and they take they put up oxygen on their on the supervision basis only, because the at most medical
Okay.
facilities are completely provided in the hospitals only. That I agree, but the first priority or the first aid we can give, just to level up the oxygen, we are providing that till the time that the person gets admission in hospital.
At the moment, you have beds available with you, Vishiba?
I'm so sorry, I didn't get you. Pardon?
Do you have beds available in your COVID care center at the moment?
At now, they all are full. There are no beds, because you can understand during this pandemic, none of the bed is empty as of now. Everyone is getting that. Yeah. But we are trying a level best to provide each
So
and everything.
you were saying you're running a mini COVID center.
True.
Yes. You are
on our
also
level, yeah.
helping people get certain supplies of oxygen cylinders.
True.
How are you
True.
able to do that? Because I'm asking you this question because people will throng to you again. The moment you are, on a broadcast channel, there will be people trying to reach out to you. What is the best way to get access to the facilities that you are providing?
See, we are taking help of Delhi police. They are helping us to get the cylinders from the plant also, as well as we are coordinating with the plant owners also, where we can get cylinders, because I understand, because there are long queues at the centers where people are standing since 2 days, in fact, also. But the way they can help us, or we are getting at our level only.
Yes, so, I hope you understand the kind of, assistance and help that you're providing to people at this point is huge, because, there are people out there who feel that they are left to fend for themselves. They are left to their plight. There is nobody to turn to. So when someone like you and your husband actually open out COVID care center, even if it's a small 10-bedded, like you said, COVID care center, at least a person gets one place to immediately go and hospitalize a person. It may not be a fancy hospital. It may be, like you said, a very simple setup. But even to do that, Vishiba Munjal, it must have taken a lot of effort on your part. Tell us more about what has been your experience like so far. Anything special that you might like to share about what you have seen and what you have gone through?
See, during this pandemic, I have gained a lot of experience, like setting up a small COVID care center also was a really challenge for me. Why is because I tried to get oxygen cylinders, I put a lot of efforts to get those first. Then there was a doctor, Dr. Srivastav. He's very nice. He helped us to diagnose the problem. Actually, the patient is having is it critical or it is normal? We can provide the first aid to here only, or he has to go to the hospital. So here, but the main problem we faced earlier was we were not getting the manpower to help us in this COVID time. But God is here. If government is not here, God is here. So he helped us.
Right.
We set up a mini center where we are.
I'm sure there are a lot of challenges, Vishiba. I'm sure it is not easy. Yes, I'm sure it is not easy. But immediately, what do you see is the biggest problem in Delhi? Because I'm asking you this question because you would have a far better understanding of what the ground situation is like. How severe is the situation in Delhi right now, Vishiba?
Severity we can't explain actually, because severity you are watching over national televisions also, you're getting around news from around also. It's like hell. Severity, we are not getting help from government at all as of now. Whatever we are doing on our level. We are not getting any help. Only Delhi police, yes, is helping us. They really help us, and to their level only, again, because they need to help many people around them. So whatever help we are getting on our own, nothing else.
Yes, I was also asking you in general in Delhi, which are the main areas of concern? If you have to list the 3 biggest problems that people in Delhi are facing today, and somebody like you is trying to help out in whatever small way, but in the larger picture, what according to you are the 3 biggest issues that need attention in Delhi?
Biggest issues are health. In health is like beds again, and oxygen is utmost. They should have, like every hospital should have plants in their hospitals. There are many huge hospitals, but they're not having oxygen plant. That's quite depressing. Why? They should have oxygen plant in their hospitals. Now they have made huge buildings. They are, according to them, they are giving all health facilities. So why can't they afford or they have not set up oxygen plant there? They should have oxygen plant so that the problem which our country, which our India is facing today,
to be, in short supply.
Yeah.
Right. Okay, let me take one last question with Ashwini as well to understand this. Okay, finish your point, ma'am.
Sorry, I didn't hear you properly.
All right, Ashwini Kumaran, one last word to you on this as well. That where do you see the government failing? Because for a situation to end up like this, people are helpless and desperate. Some citizens are making this effort to help out, but there are a lot of people out there who are still feeling helpless, who are still feeling as if there is no one out there to look after them. So tell us, where do you think the authorities have failed? In Karnataka, in Bengaluru, there are at least 2 cases we have reported of patients dying in the hospital. Chamrajnagar and in Hubballi again today in a single hospital, 13 patients have died. But what, according to you, are the failures of the government of the day?
They don't have a proper data. That's what I can tell you. They don't have a proper data of where the oxygen is less, where the availability of beds are not there, where there's no ventilators or ICU. It's because of completely with the data, they are not clear by themselves itself. If that data is clear, then even the government, not even a single like me, has to come out and help when the officials are having this. So it is completely lack of data only, I can tell you.
Yes. Okay, that's a very important point, Ashwini Kumaran, something that we at Mirana is also highlighting, that if you don't have an accurate data, how are you going to then build a strategy around it? Because that the very first step, then you have faltered because you do not have the exact numbers that you're dealing with. Vishiba Munjal and Ashwini Kumaran, thank you so much for joining us. And it's great to have 2 women Good Samaritans on Inspire India today. Truly, you inspire India. Thanks for joining us on Mirana.